keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Welcome, ladies and gentlemen. My name is Stefan Achenbach. I'm here with Dr. Boaz Rosen and Dr. Joao Lima, both of Johns Hopkins Hospital. And we are here to discuss a paper that they published in JACC Cardiovascular Imaging. The title of the paper is The Relationship Between Baseline Coronary Calcium Score and Demonstration of Coronary Artery Stenosis During Follow-up in the Multi-Ethnic Study of Atherosclerosis. That's the Mesa Study. Dr. Lima, can you give us a 1 or 2 sentence summary of what the Mesa Study is?
The Mesa Study is a prospective study that began in 2000, and it follows 6,814 Americans of 4 ethnicities, Caucasians, African Americans, Hispanics, and Asian Americans. And the goal of the study is really to tease out what causes cardiovascular diseases in people of different ethnicities. That's the primary thrust of this study.
So this study is a population-based sample. It's not patients, it's a sample of the population.
It's a very important question, Stefan, because this study is a population-based study. In other words, participants were invited to participate. No volunteers were taken in Mesa. And the other important thing about Mesa is that it excluded anybody that had a history of heart disease. So was a study designed to look at what caused disease. So we didn't really include individuals that had already a history of heart disease.
Dr. Rosen, what specifically did you analyze in the paper you're publishing now?
After the patients were enrolled in the Mesa study, and you should remember that the patients were of age 45 to 84 years old, 5 years have elapsed. In these 5 years, the people had a substantial number of the people had coronary events or positive stress tests that required coronary angiography studies, and we decided to take all the results from all the catheterizations that the patients underwent and to see to what extent do the results of the CT studies or the coronary calcium score, to what extent it predicted the results of the catheterizations.
So all these 6,000 individuals had a coronary calcium scan performed at baseline, and you correlated this to clinically indicated invasive angiograms.
Exactly.
And what did you find in your analysis?
Exactly. And most of the results were quite predictable. Out of these 175 patients, only 4% had total calcium score of 0. When you related the results of the catheterization with the initial coronary calcium score, there was a good correlation between the initial calcium score at baseline and the severity of stenosis. However, when you examined vessel by vessel, it seems that like 13 to 18% of the vessels that had severe stenosis, which indicated as more than 75%, had initial 0 calcium score in these arteries. The same results were also seen if I took as a cut of 50%.
I see. So coronary calcium was present in almost all patients who had an invasive angiogram, but not necessarily in the very vessel that had a high-grade stenosis.
Exactly.
Dr. Lima, coronary calcium is usually not used to identify individual stenosis, but much rather to assess the risk of the overall patient for future events. Does this study change this way in which we use coronary calcium?
No. Fundamentally, it does not, but it does brings some thought-provoking questions. In other words, Mesa participants that had high calcium scores had a high risk to develop events, and those who had a 0 calcium score had a very low risk. However, those who had a calcium score between 0 and 10 actually had 3 times more risk than those who had 0 calcium score.
So even though calcium scores might be very important, is that what you want to say?
Exactly. This study somehow connects with other studies that have been appearing in the literature, suggesting that even though in a symptomatic person, a person who had never had symptoms, a calcium score of 0 is very reassuring, in symptomatic individuals that we should be a little more cautious about taking that road.
Okay, thank you very much, gentlemen. Thank you very much, ladies and gentlemen, for your attention.